Thank you for joining us today. My name is Lee Montville, and I'm the Director of Special Sales at Springer Publishing. Today we are presenting Navigating the Critical Care Environment as a New Graduate with Dr. Dina Hewitt. Dr. Hewitt is currently the Regional Vice President, Campus Operations at Chamberlain University. She has worked as a cardiothoracic critical care nurse for over 15 years and in hospital administration and higher education for 20 years. Before we begin, a quick reminder. This webinar is being recorded and will be available on demand at springerpub.com/videos in 5 to 7 business days post-live event. If you have any questions, please type them in the Q&A box on the Zoom control panel. I'll bring them up at the end of the presentation. And if you forget to ask a question, there'll be a brief survey sent at the end of the webinar, and you can include your question there. Now, let's get started. I'll turn the presentation over to Dr. Hewitt.
Thank you very much, Lee, and good afternoon, everyone. It is a pleasure to join you today and talk about navigating the critical care environment as a new graduate. So just a couple of objectives that we'll talk about today. Just a little bit about the current state of the nursing workforce, the nursing shortages that we always hear about. Talk a little bit about identifying barriers to increasing the pipeline of new graduate nurses. Discuss the current state of the critical care nursing workforce, and then really dig into the purpose, discussing the state of critical care nursing residency programs, and talking about measures to help smooth that transition for the new graduate into the critical care environment. So a little bit about the current state of the nursing workforce. And I chose this graphic because it's a great representation of the diversity that we're starting to see more and more of in nursing education and in the nursing workforce that we're experiencing. So jumping into the state of the nursing workforce, we know from some of the data that has been gathered over the last several years that approximately 100,000 nurses left the workforce during COVID and dealing with the increased workload, the mental health, all of the different factors that went into caring for patients during that pandemic. We know the nursing workforce in 2022 will be about 3.1 million nurses. And while it is expected to expand by a little bit to 3.3 million nurses in 2032, that coupled with the nurses that are projected to leave the bedside, whether through attrition, through continuing mental health crises and exhaustion and burnout after the COVID pandemic. We're projecting a shortage of about 78,000 nurses this year and 63,000 in 2030. And we're still seeing some of these shortages that are regionally based, with the greatest shortages in the state of Washington, Georgia, and California. And a little bit about the barriers to educating more nurses. And that's kind of my sphere of experience right now is in nursing education at the pre-licensure baccalaureate level, is we have a lack of qualified faculty. And there are specific educational requirements that individuals have to be able to teach within higher education. And so we're seeing a lack of that qualified faculty. There's also a lack of clinical placement. So while we say it may be easy just to admit more students into nursing education programs, that lack of clinical placement can really, it really serves as a barrier to increasing the enrollment of students. And also inadequate campus facilities and equipment, because we have to have the classroom space, the lab space. Now the simulation lab space is very critical. So all of these particular variables come into play to educating future nurses, whether it's at the baccalaureate level or at the associate degree level. So continuing to work on those is very important. Specifically, the critical care nursing workforce. What are we looking at there? And a recent study by the American Association of Critical Care Nurses certainly identified that critical care nurses were disproportionately affected by the COVID-19 pandemic. All of those patients who were in critical care, the number of additional stand-up MASH type units that were put together very quickly to accommodate COVID-19 patients that were ventilator dependent really took a toll on the critical care nurses nationwide and indeed worldwide. So AACN surveyed their membership very recently, and of the 6,000 respondents, 92% of the 6,000 respondents believe their career is going to be shortened as a result of the pandemic, and 66% reported considering leaving the nursing profession altogether. And that's really scary because those critical care nurses are so important to providing that high level care for patients in critical care. And so over time, nursing residency programs have been developed to smooth the transition for someone who's going into critical care, whether it's as a new graduate nurse or it is someone who's transitioning from a med-surg area into critical care. And so these nursing residency programs are designed to provide a new graduate with specialized training and experience in the critical care setting. It'll provide the opportunity for multi-specialty training. So from the neuro intensive care unit to a trauma unit to cardiac settings, it will vary whether it's a CCU or cardiothoracic open heart unit. And it combines kind of on-the-job training through mentorship and preceptorship in the units with a structured learning environment with additional classroom education and simulation and lab scenarios. We know for a new graduate coming out of nursing education, basic nursing education, there's a steep learning curve when you get out, and to be faced with taking care of a patient that looks like this with all of the equipment, all of the monitors, all the IV drips and fluids. Many times we lose sight that there's a patient, there's a human laying here in this bed responding to all of these treatments, and learning how to begin to manage all of this as a new graduate is a huge learning curve. So finding a residency, participating in that residency is so important as a new graduate. Again, in nursing school, we're teaching you how to be a safe, competent beginning nurse that can pass the NCLEX RN exam and start to take care of patients, to have that license. So I want to dig in a little bit about the survival skills that you will need when navigating the critical care environment. And we'll dig into each of these individually. So what is the skill development that you need to think about? The unit dynamics. What does time management look like in the critical care environment? The additional learning that has to happen because, again, nursing school has prepared someone to provide safe, competent beginning care, and the critical care environment is a whole different level. Building that confidence, that is so important as you continue to take care of those patients. A little bit more about the residencies and orientations, certifications that will demonstrate your commitment, like the CCRN. Continuing education, that is vital in healthcare because things change so rapidly. Then, of course, talking about stress management and well-being. So let's dive in first to talking about that skill development. Strengthening your assessment skills is vital. Again, when you were in nursing school, we learned the basics of a general head-to-toe assessment. But these assessment skills now need to go to the next level, and how it interfaces with the monitoring that is being that is on the patients. Learning you learn basic heart sounds, really digging in with abnormal heart sounds, abnormal lung sounds, and fine tuning those assessment skills. What does a patient's skin feel like? What are their pulses like? You've learned basics, you've learned normals for the most part while in nursing school. taking it to the next level with strengthening those assessment skills is vital. The monitoring that we use on patients, whether it's the EKG monitoring, invasive line monitoring, learning how to set up and handle that equipment is very, very important. And learning those technical skills, again, learning how that monitor works that the patient's on at the bedside, how to read it, how to change it, how to change the settings that you may need to. So it's picking up just very fine changes in a patient's status and their condition. Learning how to read an EKG. So whether it's a 12 lead, the regular bedside monitoring that's going on, really digging in and learning how to read that EKG, how to interpret it, what you're looking for, what changes might be happening with a patient, and additional procedures that are done at the bedside in critical care, whether it's assisting with inserting an arterial line, a central line, an intra-aortic balloon pump. All of those procedures are done for the most part at the bedside in the intensive care unit, and learning how to help and to assist with the placement of those procedures is very important. Just to back up a little bit with those EKG skills, I remember when I had the opportunity to start in a brand new critical care unit, and it was, or a brand new cardiothoracic open heart unit. And we would accept patients from outlying smaller facilities. And back in those days, this was several years ago, the patient's record, their documents were typically faxed over from the sending hospital. And some of the techs would grab the paperwork off the fax machine. And I remember very vividly one night, one of the techs grabbing the EKG, and she even looked at it and said, "Uh-oh, this is a bad one," because she had learned how to look at that ST elevation that we see with a patient who's developing an acute MI. So it was very exciting to even see the tech who was in nursing school picking up on that EKG and understanding what it meant and being ready to assist the nurses as we got ready to receive that patient. So learning all those skills, those procedures, those monitoring techniques, strengthening those assessment skills are vital as you're beginning that transition into critical care. The next one is the unit dynamics. So learning the unit routines. What's the normal day-to-day? What does that rhythm of the unit sound like? What does it look like? What does it feel like? How do you become embedded within that culture of that particular critical care unit? Knowing the unit policies, knowing in general the hospital policies and procedures, but more specifically, and digging into the details of what the unit policies are, what you can and cannot do as a critical care nurse, what you have to be checked off on by someone else who is already an expert in care of a patient with a chest tube, and how you need to go about becoming proficient in those specific skills and what those unit policies are, how if you can manipulate a PA catheter, those kinds of things. So being very familiar with the unit policies and abiding by those policies. Knowing all of the equipment, and there is a lot of equipment that we can use on patients. And it evolves, it changes, it becomes more complex over time. In some ways, it becomes more, I don't want to say simple, but more intuitive over time as the equipment that we use becomes more high tech. Balloon pumps, I saw balloon pumps change dramatically during the course of time that I was at the bedside and in hospital administration. CRRT, continuous renal replacement therapy, which is just a very slow way of doing hemodialysis, knowing that equipment, understanding just the bedside monitoring and learning how to level all your devices and zero them out so that you're getting accurate blood pressure readings from the arterial line or central venous pressure. Learning all that equipment is key, very, very important. And developing those key relationships in the unit, certainly who unit leadership is, learning who and getting to know The informal leaders. Who are the expert nurses? Who are the nurses that will take you under their wing and teach you everything that they know? Who are the expert nurses that can come in and pick up on something intuitively very quickly? When you can't quite put your finger on what's happening with a patient, something's changing, but not quite. Who's that expert that you can go grab and bring in the room and say, what's happening here? Also, very important, feel comfortable doing that. Feel comfortable going out and saying, hey, I need some help in here. Something's not right. I need another set of eyes in here. So, developing those key relationships, supporting each other, going into another room to help another nurse while they're just maybe doing something simple as turning a patient. So, building those relationships is key. Also, developing those key relationships with the physicians. If you're working in a teaching hospital, the residents and the interns that will be coming through there. We always joke that every July the 1st is one of the scariest days that we have in a teaching hospital, because here come all of the brand new graduates that just finished medical school. Um, and I had many interactions with them. Sometimes we would have chest traumas in the open heart unit. And so the general surgery residents were in there. And at one point, I worked with a very, very nurse friendly, nurse loving surgery resident. He later became an open heart surgeon. But he would bring his new residents into the critical care units and tell them, here are your nurses. They know your patients better than you do, and you need to listen to them. They will teach you a lot. And he was I think one of my favorite surgeons, because he gave us that recognition and respect. And we taught those residents a lot. So it was a very good learning environment. Time management. So taking the time to learn how to prioritize and taking that prioritization to the next level. We talk a lot about that in nursing school. And as you're getting ready for the NCLEX exam, which patient do you have to go see first? And now in critical care, you'll typically only have two patients, and getting a report, looking at the monitor, doing a quick scan to determine who's the sickest of the sickest. Who do I need to put my eyes on first? And learning how to handle that fast-paced environment. You'll probably be shipping one patient out and moving them to the floor, and housekeeping is flipping that room around within just a couple of minutes to accept patient coming out of the operating room or patient coming up from the OR, or the emergency room. So learning how to handle that fast-paced environment, learning how to prioritize is very, very important as you're making that transition. Learning. So your learning did not end when you finished nursing school. It did not end after the first year of practicing as an RN, or even after 5 or 10 years. Because of the nuances and because of medicine and nursing, continuous learning is critical. It never ends. We see a lot of new ads on TV every day for new medications that are coming out. And so that continuous learning is critical. New procedures, new ways of caring for patients. When I first started, a patient needing a permanent pacemaker was in the critical care unit for typically 2 nights. And now it's done as an outpatient procedure in the cardiac cath lab. So the technology is changing very rapidly, so that continuous learning is critical. So purchasing additional resources, purchasing additional textbooks that will help you to learn EKG interpretation, purchasing the core curriculum for critical care, which is AACN's, the American Association of Critical Care Nurses, text, all encompassing on care for the critical care patient. So continuing to be in that learning mode is very, very important. I remember when I first graduated, I went and purchased a EKG interpretation workbook, the core curriculum, any other resources I could get my hands on. And there were some pocket references that were very helpful, especially with EKGs and types of heart attacks and what I was looking at. So having all of that ready at your fingertips. Also joining your professional organizations, because once you do that, you have access to their continuing education. You have access to the journals that are published, that are peer-reviewed journals. They also contain research, um, case studies, scenarios. So joining those professional organizations is critical. And then through that, so for example, the American Association of Critical Care Nurses, and certainly the American Nurses Association, which is the encompassing um, voice for the professional nurse. But through AACN, attending conferences, they just wrapped up what they call the National Teaching Institute, or NTI. It was held in New Orleans just a couple of weeks ago. I think we just wrapped it up last week. So joining those, and then when you have the opportunity, attending those conferences, that networking opportunity is so important. And attending those conferences, attending those seminars, they now do a lot of hands-on stuff with equipment. I just saw something else about getting out of a safe room in a critical care environment that was set up. So a lot of interactive learning as well goes on at these conferences. And then if you have joined the organization, the cost to attend it is discounted. So very, very important. And there are a lot of other professional organizations, whether it is the emergency room, neuro, trauma, burn, all of those other pieces. Those professional organizations are also out there, and I encourage you to join those. Give me just a second. Grab a little bit of water. Also, as you continue to work in critical care, you'll have the opportunity to take the CCRN exam, or the Certified Critical Care Registered Nurse exam. This is administered through the AACN and designates your commitment to continuing education, safe patient care, and a broader depth of knowledge. The CCRN is available after you have completed a certain number of hours at the bedside, and then you can apply to take this exam. I remember when I first took it, so I graduated nursing school, at the risk of telling you how old I am, in 1988. And first time I took the CCRN exam, the only time I took the CCRN exam and passed it, was in 1990. It was still paper and pencil. I had attended workshops, exam prep courses, studied like crazy through the core curriculum for critical care nurses to get ready. And AACN has a lot of other resources to help you prepare for this exam. But it was extremely hard. I remember getting the letter in the mail. I could tell if I had passed or not. And being so excited to have passed that exam and have the designation behind those initials behind your name, because it does demonstrate your additional commitment, that in-depth knowledge. There's more than just the CCRN exam now through the AACN. They also have specialty tracks. Multiple exams now are offered through the CCRN, including cardiac, cardiothoracic, even the minor specialty exams. So I encourage you to look for that and prepare for that and take that exam to designate that commitment. There are other specialty exams as well, stroke, trauma, neuro, things like that. So if you're in that specialty area, I encourage you to dig into that also and take that certification exam to demonstrate that commitment to excellence. And then continuing professional development. Again, in many states, it is now required to renew your licensure. So you have to have a certain number of continuing or professional development, continuing education hours. You also have to have that to maintain your CCRN status. And like I said, I took that exam one time. Then you have to renew it every couple of years. And I would always renew off of continuing education, whether it was through attending the NTI conference, um, if it was continuing education or presentations that were held at the hospital, through journals, through continuing education courses. But maintaining that, I never wanted to have to take that exam again. I thought it was harder than the NCLEX exam. So it's required to maintain that CCRN status or any other certification exam status. Staying up to date on techniques and procedures. Like I said before, techniques change, monitoring changes, equipment changes. We used to only have the intra-aortic balloon pump for cardiac support. Now we have Impella devices. Now we also have ECMO, extracorporeal membrane oxygenation, which is almost kind of a form of bedside bypass that's done in the critical care units. So staying up to date on all those techniques and procedures and the continuing education associated with that before you care for a patient with that particular device. And of course, again, joining those professional organizations, it gives you access to journals and to articles and to additional online learning through those professional organizations. A little bit on stress management and well-being. Again, so important in a very fast-paced, high-stress environment. So I just pulled out a couple of things just for well-being and thinking about yourself and your personal mental health and your personal well-being. Staying hydrating and eating well-balanced meals. No, I'm not going to talk about the water bottle on the desk when Joint Commission comes, but bringing your lunch with some well-balanced meals is important. Staying hydrated is very important as well. On the days off, exercising and getting out, and even if it's just walking, is very good for not only exercise and maintaining that flexibility, but also mental health. Getting 7 to 8 hours of sleep, trying to separate work and home life, spending off-duty time with family and friends. And in some situations, that means don't look at your phone on your days off. We as nurses, we want to answer that call. And even if you're not on call, if the hospital calls and says we had 3 people call out, we need some help. Sometimes the reality is you have to be able to separate that. I'm now an advocate for it. So don't look at your phone on your days off. Maintain a positive outlook, participate in hobbies outside of work. A lot of us as nurses are very crafty and enjoy outside hobbies. So really develop that. Always maintain a sense of humor, no matter what's going on. You've got to be able to laugh appropriately, but maintain that sense of humor when everything else seems to be falling apart. I remember one time it was right after we started the Open Heart program, and we weren't going to be doing any emergent cases or any overly complicated cases to start. And the plan was to do simple 1 and 2 vessel bypasses until everybody got their feet on the ground and we got settled. And we were going to do that for at least the first 2 to 3 months. Within 4 weeks, I look up and here come the people from the cardiac cath lab with what looked like a very sick patient rushing into the OR elevator to go down to the cardiothoracic suite. And I just laughed and I said, well, our days of doing simple, uncomplicated cases have now ended. We're going to start this a little faster than we anticipated. But did a great job, and I was very proud of the staff. We took great care of those patients. So keep that sense of humor going. Sometimes just take 3 seconds to breathe, even if it's during hand washing in between patients or in between procedures. Just close your eyes and take some deep breaths. If you do have any concerns about patients, coworkers, or doctors, have that conversation with your unit manager. And then seek counseling if you need it. Learn how to handle that grief, the emotions, and the stress. It's going to come with it. It is part of being a critical care nurse. Um, we had a bad situation, trauma in the unit, and it was teenagers who had been involved in a very bad car wreck. Um, and unfortunately, we knew what the outcome was going to be. And that family was there, and they had their minister, their spiritual counselor. And I called down and got the chaplain service just for my staff because I could see it, I could feel it. And I thought because many of them had kids that same age. And so I wanted to make sure they were okay. So while the family had their minister with them, I had the hospital chaplain up there for my staff. So seek that counseling when you need it, and don't be afraid to ask for it. So this will help you to build confidence and develop and learn to trust your instincts over time. The more that you are in the critical care unit and the more that you get that experience. You'll learn to trust your instincts. You'll learn to listen to your gut and to trust that. And as you develop that relationship with your physicians and they recognize that you know what you're doing, when you call with the least little thing, they will be there. And learning how to communicate with them, building that confidence, building that trust is so important. And so over time, you will be able to develop that and be an extremely proud day in your nursing career. So with that, I'm not sure if I can see the chat or I'll open it up now to
Sure,
any
Dina. Thank you.
questions.
Yeah, thank you so much for an excellent and informative presentation. We're going to go ahead and take time for some questions now. Just a reminder, please be sure to type your questions into the question box on your control panel. So the first question we have is, are there specific certifications or courses you recommend before starting in critical care? For
Great
example,
question.
ACLS, CCRN prep. Yes.
Yes, absolutely. So ACLS is definitely a must. That's advanced cardiac life support. Very, very important. And many hospitals, just about all critical care units will require that the nurses have ACLS. So whether it is taking it right at the start of your transition into critical care and then maintaining that every 2 years is very, very important. Again, with certification exams, most of them require that you work at the bedside for a certain number of hours before qualifying to take that CCRN exam. But the important thing is starting to prepare for it from the very beginning, because it will give you that knowledge that you need to provide excellent care. So, of course, I mentioned CCRN earlier, the critical care registered nurse, and either taking courses. Now, again, if you are lucky enough to be in a residency program, a nursing residency program, typically it combines classes with bedside care, paired up with a mentor at the bedside. So, taking those classes, keeping that CCRN right beside you, or the core curriculum for CCRN right beside you, is also very helpful.
Awesome. So the next question is, what are the most common knowledge or skill gaps that new grads face in critical care?
Oh, great question. I would say probably the invasive monitoring. We can get overwhelmed with that, with arterial lines, central venous lines, PA catheters, pulmonary artery catheters. So many times it's that, and then also the medications, the IVs, whether it is something to help blood pressure, keep it up, keep it down, um, improve cardiac output. Um, uh, a vasoconstrictor, a vasodilator, all those different types of medications. So the pharmacological aspect, which I did not touch on earlier, is equally important. And knowing all of your medications and exactly what they're doing, what you're looking for, what you're assessing for after you start that medication is very important. And I think one other little thing that I've seen many new grads in critical care, someone who is transitioning into critical care, will go and make changes on the pump setting and hit start and then look at the patient and expect immediately to see something change, whether the blood pressure comes up or goes down. And so you'll give it about 2 seconds and then go back to the pump and push the buttons again because nothing has happened, and look at the monitor and nothing's happening. Remember, it takes a little bit of time for that medication to progress down a lot of IV tubing. So give it a couple of minutes to work. It's not going to happen immediately. So give it a little bit of time, because if you don't and you keep making those changes, the next thing you know, if you're using a medication to lower blood pressure, it's going to be way too low. And now you're just hitting the machine again and the blood pressure goes screaming back up. So learning that patience also with those medications.
Great. What are effective strategies to bridge the gap between classroom learning and bedside application in critical care?
Good question. Um, Certainly the experience is there in critical care. If you're lucky enough while you're in nursing school to get a preceptorship in critical care, that will help tremendously. And now through simulation is a great way to apply that content, to apply that into a pretty close to a real life setting in a simulation environment. And as I like to describe it, you can quote unquote crash the plane. Simulation in healthcare is based on pilot training and the simulation that the pilots go through as they are learning a particular airplane and learning how to fly in certain conditions. Simulation training, when it's done well, when it's done correctly, will provide a very, very close real life scenario. And so applying that in a safe setting where you can quote unquote crash the plane and then reset it and learn from that and do it over again is another very powerful way. So many residencies, many hospitals now do have very high tech simulation labs, everything from mother baby, labor and delivery, pediatrics, the operating room, anesthesia, where you can go in there and actively engage in a real life scenario and learn from that. Because and in those situations as well, you'll have the opportunity to do very low volume procedures that are very high risk. So maybe it's an open chest arrest or something like that. And you can do that and get your hands on that equipment. But that's another very good way to bridge that gap.
Great. What advice do you have for managing stress and avoiding burnout in a high acuity environment?
Very, very important. Again, we touched on it a little bit during the presentation, but even just taking that time when you're washing your hands to just be present within yourself and take some good deep breaths, relax your shoulders is very important. Getting out of the unit for your lunch break, if you can, go outside, walk around for just a little bit. When I had an open heart unit, when I had charge nurses that were running the unit, when it was time for their lunch, I would take their what we called a spec phone at the time. I would take their spec phone and make them leave the unit. In one way, that was modeling what I wanted them to do for the other nurses. Get out of there for a little bit, even if it's just a walk down to the cafeteria. But if you can go outside for a minute, feel the sun on your face, take some good deep breath, fresh air, that's very important. And again, setting those boundaries. I saw a very interesting study that the generation of nurses now will prioritize their work life and their personal life. And will probably not be raising their hand to work that extra 8 hour shift overnight or to come in extra on what are their days off. And I can understand that. I can applaud that. So being mindful of that, again, exercise, hobbies, anything that will help to separate yourself away from that critical care environment.
That's great. Um, Darla mentioned in the webinar chat, she said the background, I'm a 32-year career RN, former ICU and CCRN, 1994 to 2008. Past 4 years instructor for ADN community college program. First time I will oversee an ICU clinical rotation this summer semester. What would be the three most beneficial focus for the nursing students during the clinical rotation? Current
Oh,
plan is one, assessment, two, ventilator, three, monitoring. Any suggestions? Thank you.
I love that. I love that. Yes, that assessment, very, very important. Don't be afraid to get in there when, go in there with the students, introduce them to all of the equipment, introduce them to the patient first, but all of the equipment, doing a in-depth head-to-toe assessment, really fine-tuning auscultation, listening to those heart and lung sounds, finding those, even if it's not the patient that the student may be assigned to, something else that might be very interesting. That's a great learning opportunity. Get everyone in there as you can to see that and learn from that. Again, the ventilator, very important. Bring in the other interdisciplinary team members as you can. So grab that respiratory therapist. They're absolutely brilliant. And bring them in and ask them to talk about the ventilator and the different parameters that the ventilator is set to, what they're looking for when they're assessing, um, if they're getting ready to wean someone off, if you can find that opportunity and they're taking out that endotracheal tube. So bring in the other team members to talk about what they're doing, how they're working with the nurses to take care of those patients, and how they're handling that ventilator. And then what was the third one? Was it the monitors?
Sorry.
I
Yes.
can't see the
Let
chat.
me pull
Yeah,
it. Let me pull it up. Sorry. Assessment, ventilator, monitoring.
monitoring. Yes, and then
Yeah.
monitoring. What are you seeing up on the big color-coded monitor from the EKG to the O2 sat waveform? If they have an A line, a CVP, a PA catheter, um, introducing them to all of that, what they're expecting to see, and what the kind of what the normals are. So, and then I would concentrate also on the medications. Excellent
Great.
question.
Great. Rosetta has the following question. With the variance in preceptors in the clinical setting, we at McGill have developed a nursing clinical dialogue guide for our post-clinical conversations. What are your thoughts on clinical debriefs?
Oh, so very important. Clinical debriefs are vital. So the students can share what they saw, what they learned. They can hear that from each other and those shared experiences. It's just like debriefing after simulation is a very, very powerful learning tool. So it is critical to do those post-clinical debriefs, have everyone share just a little bit about their patient, what they learned, whether it was an assessment, the monitor, medication, um, absolutely vital and a great learning opportunity.
Great.
And let
Let's
me
see.
add right quick, just and two,
Yeah.
speaking as an educator, getting students ready to take the NCLEX exam with the clinical judgment questions, that is another great opportunity to incorporate a scenario and why a nurse did what they did based on labs, based on the assessment, whatever may be happening. That is a great way to incorporate clinical judgment.
Excellent. Excellent. Um, so we had another question that came through is how can new grads build trust with seasoned nurses and interdisciplinary team members?
Great question. I think the new nurse needs to show that and by no means are we eating our young, but show that they are willing to learn, that they don't know everything yet. I think the worst thing is to go in and think that you already know everything, because you don't. Um, so be willing to learn. I think too, a very important lesson that I learned when pairing a new graduate was how, so I like to think of Benner's theory of novice to expert. Sometimes that top expert nurse cannot clearly explain it anymore. They know what they know, but sometimes they can't get into the nitty gritty and really explain it. Whereas maybe the proficient or the level right below the expert nurse, they can still talk through exactly what they're thinking about, exactly what they're looking at, why they're doing what they're doing based on the patient's labs or the way their vital signs have been trending during the day. And they are the best one to serve as that preceptor, but still wanting to learn from that expert nurse um, what they are seeing, what they're thinking about. But they may not always be the absolute best one to teach and to be the preceptor. So looking at that skill and that model set. I had an excellent open heart nurse, by far one of the best. She'd been in the cath lab. She could read a cath film like nobody's business, expert, but wasn't necessarily the best one to precept someone brand new, because the expectation level is very high. And it was made for a bad situation. But the one that had been in there for about 3 years, that was still learning, they were an excellent, excellent preceptor.
That's great. Excellent. Awesome. Well, it looks like we've covered all of our questions. And if we want to go to the product slide, um, we just want to thank everyone for spending time with us today. And thank you again to our host, Dr. Hewitt, for a great presentation. If you're interested in purchasing the new edition of, um, of Dr. Hewitt's book, Fast Facts for the Critical Care Nurse, third edition, publishing June 28th, you can pre-order a copy on Amazon.com or scan the QR code below and get an alert when the book is published to receive 25% off the list price with the code webinar25. I want to remind everybody that the recorded session will be available on springerpub.com in 5 to 7 days. And we want to thank everybody again for taking the time to spend the time with us today. We wish everyone a great afternoon, and we look forward to you joining a future Springer Publishing webinar. Have a great rest of the day. Thanks again, Dr. Hewitt.
Thank you. I enjoyed it. Thank you.